Hi, my name is Walter Miranda, and my topic is effect of trascutaneous electrical nerve stimulation alone or as additional therapy on chronic post-stroke spasticity. Systematic review and meta-analysis of randomized control trials. Introduction. Stroke is a cardiovascular non-communicable disease and the main cause of acquired adult disability. It is a global healthcare problem. 15 million people worldwide suffer a stroke annually and 5 million are left permanently disabled. Deficit in motor control and limited mobility are the most recognized impairment caused by stroke. Spasticity can reduce quality of life, functionality, and daily activities because of the articular deformities, disability, and pain.
Pain is transmitted via the PNS to the CNS. The fast fibers of the PNS carry the initial pain stimulus to the spinal cord. Other neurons carry the stimulus from the spinal cord up to the brain. A problem can arise here. A pain memory is created. The neurons in the spinal cord create stimuli on their own and send them up to the brain. Transcutaneous electrical nerve stimulation. TENS. TENS helps mainly via afferent stimulation, symptomatically, without side effects, without drugs. Low-frequency currents are taken up by receptors in the skin and carried to the spinal cord by A-beta fibers. They act in the spine to inhibit incoming stimuli and prevent spinal neurons from firing spontaneously. The pain-relieving effect is thought to result from this gate control mechanism.
Application in physical therapy. Trascutaneous electrical nerve stimulation is a safe, low-cost, non-invasive treatment mainly known as resource of treat pain condition by selectively stimulating a beta first causing presynaptic inhibition.
Good afternoon. Today I will show you how to use the transcutaneous electrical nerve stimulation system, also known as TENS. So it is basically this unit with two electrodes that we will place on either side of the forearm, right below the joint. We will hold them in place with hypoallergenic tape, and we will use this gel to lubricate the pads. So let's get started. First off, I will lubricate one pad, like so. I will use the other pad to spread it across evenly. The other one will be on hold for a second. Place the electrode like so. And hold it down with the tape. Okay, we will do the same thing for the other side. Like so. Okay, once the electrodes are in position, we will need to adjust the tense unit. First off, we will begin by setting the frequency. The frequency should be set to 70 Hertz. Secondly, we will set the pulse. The pulse needs to be set to 200 milliseconds. And the mode is set to normal because it's a continuous mode. Right up at the top, you have your amplitude. This will adjust the power of the machine. You're supposed to feel a slight tingle once it's on. You shouldn't feel any pain or discomfort. Adjust it till it's comfortable. Do you feel a slight tingle? It's not painful at all? Excellent. You will need to use this treatment once a week for 15 minutes for a total of 3 weeks.
Pros and cons. Pros. Trascutaneous electrical nerve stimulation as additional treatment to physical interventions can lead to additional reduction in chronic post-stroke spasticity. Cons. More studies are needed to sustain the best protocol of trascutaneous electrical nerve stimulation to the treatment of spasticity.
After a stroke, patients may no longer be able to correctly perform simple everyday movements, such as drinking from a glass. Drinking is still realized as a task, but the impulse sent from the brain is not sufficient to trigger the proper movement. This process can be practiced with functional electrical stimulation to improve motion sequences on a long-term basis. Drinking is realized as a task. Patients are thus motivated to perform the necessary movements. Motion strategies are planned, controlled, and adapted. The EMG function of the electrostimulator measures and enhances the patient's motion impulse to enable successful movement. Multi-channel electrical impulses support motion control. Successful learning depends on the patient actively starting the movement, repeating the movement, and using it in everyday life to obtain long-term success and increase their quality of life.
Issue play in Ecuador. Once the diagnosis of cerebrovascular disease have been clinically established, neurological scales are used to obtain a standardized physical examination that allows us to quantify the degree of deficit, determining the affected vessel, provide an early prognosis and potential complications. Conclusion: of 6,500 articles identified, the STEM study with 360 subjects were included in the review. Subcutaneous electrical nerve stimulation alone as additional therapy is superior to placebos teams to reduce post-stroke spasticity except with modified Ashworth scale, especially in lower limbs, which is accordance with the studies that use other scales. Low frequency stents showed a slightly large improvement than high frequency, but without significant difference between subgroups. Most studies present low or unclear risks of bias. Thank you.